All right, let's bring the next slide up here. So we just talked about, that Delta variant is 2x more transmissible, which is why it's big cities like New Delhi, a lot of big cities in England. Now we're seeing a lot of cities in United States, the big cities. It's going like wildfire, the Delta virus. Um, and that's why we need to, even if you are vaccinated, you should still wear mask in indoor places without good ventilation. If you have a option, then sit next to a window and open the window, even if you're vaccinated. So having vaccination does not give you, unfortunately, kryptonite. It gets you, we'll cover that, reduces your chance of getting severe disease, but you can still get the disease. So it's very important to still be masked, if we have to take one lesson from this talk. Let's
Yeah,
take with the next slide. Um, so you want to touch on that. What's the risk of being unvaccinated, Sandeep?
yeah, the risk of being unvaccinated is pretty high, especially when you have an agent that is so easily transmissible. So you're just playing Russian roulette, so to say. It's like going to war with absolutely no preparation, no gear to protect yourself, because the virus is out there and it's going to get you. There is nothing that's going to protect you. If you are non-immune, it's going to get you. So all you can do is really to put a defense barrier between you and the virus. And that is where the layered approach that has been talked about and promoted should be thought of as your first line of defense, starting with masks, social distancing, then vaccines, of course, and then monoclonal antibodies in case you're exposed or have mild disease. Because once the inflammatory cascade goes on and you get to a point of very severe disease, then it's just small chances. I wouldn't say small, but at least your chances of making a successful comeback from that point go on diminishing as the time goes on. So your best chances are not to get it. If you get it, then hopefully intervene when you have mild disease and not get to the severe stage. And masks prevent you from getting the disease. Also, they prevent you from transmitting the disease to your loved ones or your friends or people that you interact with, so your community. Um, then the next step would be social distancing. That also it adds on a layer of safety, because we all know that this virus is transmitted in the respiratory secretions most. The other modes that were initially talked about, touching, food, grocery, we all did crazy things in the beginning. But those are really not all that
Right.
important. The most important thing is masking and
Let's
social
bring
distancing.
some, real life data for our audience from the places we work at, the hospitals. And I was looking at the data; it's very striking, and people need to make their own interpretation. Though it's a small subset of data, but it gives you a at least an idea of what's the difference between vaccination and unvaccinated patients with COVID-19 with Delta strain, which is the 80% strain right now circulating in that ballpark. So one of the local hospital has in last couple of weeks 140 to 150 COVID-19 beds in the hospital, or occupied beds from the COVID-19 positive cases, RT-PCR positive cases. Out of that, 15 to 20 are vaccinated. So if you do the math, that's a pretty much big percentage of unvaccinated. Not only that, in this third wave, what we're seeing is the patients in their 30s, in their 40s, in their 50s are the one getting affected, as the senior population in Florida got vaccinated early on. So, they had the huge advantage, and which I'm grateful, because their immune system is not as robust. Plus, they have more comorbid conditions. So we're seeing, in the hospitals, more younger population. We're seeing some older population if they have, comorbid conditions, or if they got an infection. So let's filter it down or distill it down further. So out of those 150 or 140 cases in that particular hospital, 25 are in the ICU, and that out of 25, hardly 2 or 3 are vaccinated. So if you look at the big scheme of things, yes, slightly, you know, few numbers of patients who are vaccinated, 20 out of 150, did get the disease. But if you filter it down to the severe disease, getting COVID-19 pneumonia, or as you said, the inflammatory cascade, they are not as much. So there is a line which the vaccine is drawing, even in Delta strain, which is, the original vaccine, as we all know, is for Alpha strain, the original strain. But even with Delta strain, we're seeing the efficacy in the vaccinated patients and not getting severely sick. So I just wanted to bring that up. Did you have the same experience? I know you go to many more hospitals than I do, Sandeep.
Yes, this is system-wide in the county. The same scenario is playing over and over again. We are seeing more patients who are unvaccinated, who are getting the illness, and then certainly a disproportionately larger proportion of patients who have adverse outcomes are unvaccinated. CDC has collected some data on this, and there is a nice graph which kind of illustrates that. We don't have that slide collated here, but just mild to moderate or even mild disease, a vaccine gives you about 8 times more protection. And the chances of getting severe disease or even dying from coronavirus infection is reduced 25-fold by vaccination. So I think that's kind of the end of the argument as far as you look at the numbers, that it is protective. We all know from the trial data that it's efficacious. There was some concern that the Delta variant may have some escape from the vaccine, and it probably has some, but that is negligible. Certainly not so much to say that, oh, since it's not working, I'm not going to take it. I think you don't know what the next variant is going to be, and that still may be captured. And vaccinated people also shed the virus for a smaller amount of time. So even if you do get the infection, if you're vaccinated, you probably have similar viral loads in your secretions, but you don't have those for as longer a period of time. So your chances of shedding the virus and giving it to one of your close friends, relatives, associates is less too. So that also is an advantage. So not only do you protect yourself, you also protect your loved ones. And so that's an advantage that needs to be highlighted.
I think we can also learn from the influenza vaccine experience. Influenza vaccine, a lot of folks may not know who are not in medical field, is not as efficacious as COVID-19 vaccine. The influenza vaccine is probably 40 to 50% efficacious depending on the strain on that particular season. But what we see is, even despite the mutation, that's why the influenza is so hard to control with vaccine, and we have to take a vaccine every year based on the new strain. But this data has shown that if you got the vaccine year after year, even you get a new strain, there is some similarity or commonality in the immune response to a new strain from having been exposed to the vaccine in the previous years to other strains, that you will get symptoms, but they won't be very severe. So with the new strain on the horizon, like MU strain coming from Latin America, we're going to talk about that in a minute, it may evade the vaccine immunity antibodies, but then there is a cellular level immunity as well, the T cell immunity. And that may be, as you said, the layered immunity the vaccine provide. And it may not be exact immunity, but it will still get you some immunity, what we learned from the influenza. Is my interpretation correct, Sandeep?
Yes, it is. And again, when you talk about influenza vaccines or other vaccines, we really haven't seen them in a pandemic situation. The whole thing is a different ballgame when you're in a pandemic, because the numbers are so amplified. Everything is happening in multiples of numbers in a very compressed time frame. So the downstream damage is just tremendous. When you look at in a year and a half, how many lives have we lost? How many people have gotten sick? Over 41 million cases of COVID in a year and a half in America. In Florida, like the slide you put up, 3.3 million people ill. And look at the death number, 46, almost 47,000 people lives lost in a year and a half. If you take all of the United States, it's almost 670,000 people. So, you cannot take these numbers lightly. Even if one hasn't experienced it, or you haven't lost a neighbor or a friend, sometimes you don't feel it. It's just a number that you hear in the news or read in the newspapers. But in the hospitals like you and I go to, and I'm sure all the nurses who are working day and night, and the healthcare professionals, they see it day in and day out. And so it's real. And
the other piece is, as you rightly pointed out, the amplification in a pandemic. People don't realize. They say, okay, it's just 2% mortality. It's not Ebola. That's true. It's, thank God it's not Ebola, and it's not as has higher mortality. But the number of cases you get in one shot, where there is the whole swath of the population is unvaccinated or has not been exposed to it, and the number overwhelms the emergency department, the hospitals, and then what happens to the patients who needs bed for other emergencies like heart attacks, strokes? They don't stop. They happen at their regular rate as well. And now there is no ICU beds because all that is jammed up by COVID-19. So, the domino effect, we just saw the numbers of the mortality, which is staggering, the 660,000 United States. We're not accounting for, the inefficiency it has caused in the hospitals for the regular emergencies. We get trauma, we get infections, sepsis from other bugs. So I think people have to understand that, I take the vaccine for myself, as you said, for my family, and also for my friends and community. And same is, responsibility of my neighbor, my friend, to do it for me and my family. So it's more a, thing we do for the whole community.
Exactly, meaning you want to lend a helping hand, and this is the least you can do. And it's really not all that asking too much, in my opinion. Of course, it's a personal choice. But, once you wear a mask, it's not a big, huge demand on anything. And it's not a badge of pride or a badge of cowardice. It is just a practical solution. And the same goes for vaccine and social distancing. It's better to be prudent and be careful. If there is a storm coming, we take shelter. We board up our homes if a hurricane is coming. This is amongst us. What more are we waiting for?